Hey, I'm Dr. Rich. I'm a general dentist with over 25 years of experience, and I'm here teaching you about dentistry and teeth so that you could have a very nice smile. So recently on one of my other videos, my What is an Immediate Denture video, I had a viewer ask me if I always made immediate dentures for patients. Well, the short answer is no, I don't always make an immediate denture for a patient. It all depends on the particular situation, both the patient's needs and desires and what the condition of their mouth is. So in this video, I'm going to go over all the different things I take into consideration when I make this decision as to what my recommendation is for the patient, and also to give the patient, let the patient know what to expect during the process. So first off, personally, if it were just up to me, I would prefer just to take out all the teeth, let the gums heal for 6 weeks at least, and then make a set of regular dentures. So here are my reasons why I would prefer to pull all the teeth first and then make the denture. I'm going to be able to make it get a much better fit. I can get a much better denture impression, and with better impression, the denture is going to fit better and stay in place better. We can try it in before we deliver it, so I can make sure that it looks like the person wants it to look. Proper teeth color, the proper shape, the proper position of the teeth. And we can make sure any adjustments we need to do, we can make those adjustments. And once the denture is made, there's actually fewer return visits for a denture adjustment. Since the gums are already healed, there's always going to be some adjustments needed, but not as many as an immediate denture. And I also believe people can transition much better from having no teeth to having denture teeth versus going from having their own teeth to having denture teeth. Let me explain that. Even when a person has teeth that are not in great shape and they're going to end up losing them, unless they're really bad, most people can still chew fairly well with them. They can eat their foods they enjoy eating. There might be some things they can't bite into, they might not be biting into apples, things like that. But from there, and then going to dentures, which is just basically 2 blocks of plastic with plastic teeth on them that are just resting on top of the gums, it's a huge downgrade in chewing efficiency and being able to eat and chew your food properly. So by removing the teeth first, and during that healing phase, person's going to be eating just softer foods. They're milkshakes, scrambled eggs, pasta, they're gumming their foods. They don't have any teeth to chew anymore. So then once they get their once they get their dentures and they go start eating, now all of a sudden their dentures are going to feel much more efficient to their gum compared to just gumming their food. So psychologically, it's just easier for the person to adjust. If that's why a lot of times too, if somebody's got a mouthful of teeth and they're going to be losing them, I try to get them to get some dental implants in, either snap-in dentures or ideally fixed implants, because fixed implants are going to be more like having your own real teeth. If it was only up to me, that's how I would do it. But it's not always up to me. It's not just up to me. There's a person involved here too. So as a dentist, some dentists tend to forget this, that they actually, they focus solely on the teeth, on the mouth, and they forget there's a person attached to those teeth and attached to that mouth. As a dentist, I need to include that person in the decision-making process, give them the pros and cons, let them know the benefits, the pluses and minuses, what I can do, what I can't do, and we'll take it from there. One rule of thumb that I use is the fewer teeth remaining in a person's mouth, the easier it's going to be to make an immediate denture. The more teeth that are left in the person's mouth, the more difficult it's going to be to make an immediate denture. So I came up with a little decision tree to help kind of guide, that I use to guide myself through the process, and hopefully you'll find this helpful as well. So I'm going to put them up the screen, and we'll go over it and discuss this. Okay, so just starting off, we've already decided, we're going by the assumption, we've already decided person's going to get dentures. We're not talking dental implants, anything like that. This is just removable dentures. So my first question to them, are they okay going without teeth? Yes or no, basically. It's a yes or no question. If yes, they're okay with going without teeth, great. We just remove all the teeth, let their gums heal, and make them a denture. Now, if they're not okay with pulling their all teeth, my second question is going to be, well, are you okay with me pulling just your back teeth? So if they have a mouthful of teeth that all need to come out, and they still want to keep their front teeth so they can smile and when they're speaking with people, what I'll do is I'll remove all the back teeth except for one on top, one on the bottom, just so it gives them a place to bite. So we still have a record of their bite. And then that way we'll leave the front teeth until the very end. That way they can still smile when they speak with people. Chewing is going to be a little bit difficult though, because there's not going to be any back teeth to chew with except for that one premolar on the top and bottom. So again, we let the patient know ahead of time, and then we make them let them make the decision. So if they're okay with me removing their back teeth first, letting the gums heal, that's what I'll do. I'll take all the back teeth out except for one premolar, top and bottom, give them something to bite on. Occasionally I'll leave one, premolar on each side too, so they can chew either side. Not the most efficiently, but better than nothing. And then from there, we'll start making the media denture. So we can get a much better fit with the back teeth not in position. I can get a great impression back there. The front though, we're still going to have some issues with it. Yeah, we can't try it in for looks. I can try it in to make sure the bite's okay, but I can't try in the front teeth to make sure how they look. And then the second answer to this, if they say no, they're not okay with getting their back teeth removed, well, then what I look at next is, well, what's the condition of their teeth? Now, if their teeth are are their teeth pretty straight? Are they in an ideal bite, what a dentist would call a class 1 occlusion? Are they not too loose? They're not flapping in the wind, as we'd like to say sometimes, where they're so loose from periodontal disease. If that's the situation, they're fairly straight and in a good location, then I tell them that yes, we can make you an immediate denture, and I will make an immediate denture, but there's always going to be a slim chance that the final denture, they're still going to need a final denture in 6 months. But I'm okay trying to make an immediate denture. There's going to be a lot of issues with adjustments. There's going to be a lot of issues. There's going to be some issues with it getting looser over time as they wear it during the healing phase. But I should be able to make them a good immediate denture. Now, if their teeth are not in good shape, they're very loose, they're not in the ideal location, they're very crooked and stuff, I can still make an immediate denture, but I tell the patient, consider this denture a healing denture. Everything's kind of wonky. The lab's not going to have very many good landmarks to get an ideal setup for the teeth on the immediate denture. So we'll make basically a healing denture. We'll make it, pull the teeth, pop them in. I tell the person not to, if it looks okay, great. That's just an added bonus. But there's a good chance it's not going to look, something's going to be off on it. Same thing, the fit's not going to be good because it's very difficult to get a good good denture impression when the teeth are all crooked, out of position. Some are really loose. We'll have to pack wax around them so they don't lock into the impression material. I've had some situations where I was worried the teeth were so loose that they might actually pull out from while I'm taking the impression. So while I would actually numb the person up first, some Novocaine around the teeth I'm worried about, just in case they came out in the impression. Luckily they didn't, they stayed in put. I was able to block out any undercuts with some wax pretty well. But it's a little nerve-wracking for me as a dentist having that type of situation. All right, so now that we covered that, what about those situations where the person already has a partial denture and needs full dentures now? Does that change my thought process at all? No, not really. It's the same rule of thumb applies. The fewer teeth they have in their mouth, the easier it is for me to make them an immediate denture, and I'll go that way. The more teeth they have, I recommend trying to pull them out. There's going to be the more teeth they have in their mouth, the more compromises there are going to be with the immediate denture, and so we have to take that all into account. End of the day, it's going to be up to the person. There was this case, here's a case that I can show where the person had some really beat up teeth on top and bottom. We ended up saving his upper teeth and did an implant or two to replace some missing teeth. On the bottom, he only had 3 teeth left on the lower left-hand side, as you can see. In that situation, I felt very comfortable being able to make them an immediate denture. We just worked around them, and once the denture was ready, pulled the teeth, fit the denture. A few months later, as the area healed up and shrunk where the teeth used to be, I just had to reline that little section of it, where the 3 teeth are. The rest of the dentures still fit great. Alrighty, so thank you guys so much for watching. I hope this gives you, everybody who needs a denture, I hope this gives you something to think about. I hope it explained my thought process as well as to why I do or why I recommend the things I recommend for patients. And one thing to keep in mind too is this is just what I do. This is what, based on what I've been taught, what I've learned over the years, my experience, this is what works for me. This is not true for every dentist. Other dentists are going to have other ways of thinking about it, other things they want to do. One's not right, one's not wrong. There's many ways to skin a cat. So thank you all so much for watching. See you in the next video.